As we progress into the future, oncology is witnessing remarkable breakthroughs driven by cutting-edge technology and innovative approaches. Hi, I'm Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss about latest advancements in the field of oncology. Joining our discussion today is Dr. Rajesh Bollam, Consultant Medical Oncologist and Hemato-Oncologist from Yashoda Hospitals, Secunderabad. Welcome to the program, Doctor.
Yeah, thank you.
So for the longest time, cancer remained in the shadows, especially in our country. But now the incidence is continuing to increase. So what do you think the burden of cancer in our country is, Doctor?
It's a wonderful question. The incidence of cancer is increasing in India day by day when compared to the West. And if you see the Globocon data, the approximate numbers used to be 100 by 100,000, and which the number is going to increase by 10 to 20% in the next 3 to 4 years.
So in India, it is estimated that at any given point of time, there are 25 to 20 lakh cancer patients. So what do you think the causes which are leading to these numbers, Doctor?
So it's a mixture of causes. One, definitely there is a change in lifestyle, especially more and more of urbanization and addictions like alcohol, smoking, sedentary lifestyle, obesity. These have definitely contributed to the increase in cancer incidence. But second thing, longevity of the life has been also increased, and more importantly, we are diagnosing more and more cases through screening. So it is a combination of advanced screening methods which are available, longevity of the life, and mainly change in the lifestyle like alcohol, smoking, sedentary lifestyle, and obesity. These are the few of the causes for sudden increase in the cancer incidence.
I think you've mentioned an important point, that is screening test, which aims to detect cancer before the symptoms appear. So what are these tests, and when do you think one should get them done, Doctor?
So screening is a broad term. It actually depends on age, sex, and the risk factors. The most common screening test what we advise, especially in a female, is mammogram and a pap smear. Pap smear is usually for cervical cancer, and the age of screening is 25 years onwards every year. And for breast cancer, the commonest screening test what we use is mammogram, that is from the age of 45 annually. In the male, we usually advise prostate cancer screening from the age of 60 and above by a test called as PSA and digital rectal examination. Both in male and female, for a colon cancer, we do have a stool for occult blood and colonoscopy. These are few of the standard screening tests which are available in India, which are approved by the government of India. Nowadays, lung cancer screening is also picking up, especially low-dose CT scan in a smokers, at least who had a history of 15 to 20 pack years, are eligible for this screening test.
So I'm sure cancer care is witnessing remarkable change, especially in terms of diagnosis and treatment. So what are some latest advancements in the field of medical oncology?
Medical oncology has improved a lot in the last 1 to 2 decades. And if you see in the last decade, it has got a wide variety of newer options. Previously, a decade ago, we used to have only a chemotherapy as an option for majority of the cancers, which used to have a lot of side effects. But with the later advances like targeted therapy, biological therapy, immunotherapy, and latest kid on the block, that is CAR T cell therapy, we have got many newer advances in medical oncology. And this medical oncology also includes, if you take a hemato-oncology, we do have got bone marrow transplantation, both autologous and allogenic. If the patient is not eligible for bone marrow transplantation, we do also have CAR T cell therapy. So these are few of the latest advances in the field of medical oncology.
So you've mentioned about targeted therapy. So how does precision medicine allow for personalized treatment plans for patients, Doctor?
So basically, when compared to the chemotherapy, the side effects of targeted therapy is limited, and the patients will have a better quality of life when they are on this therapy. Because when you give a chemotherapy to a patient, along with the cancer cells, normal cells also do die. But whereas in targeted therapies, this treatment specifically affects and goes and attacks the cancer cells which express the target. So by doing so, the quality of life is preserved, and other side effects of chemotherapy can be avoided. But which targeted therapy to be used and in whom depends on genetic testing and molecular testing, like especially with the latest advances like NGS, next generation sequencing, precision medicine has become the new norm in the medical oncology field.
So the bottom line is that most of the side effects which are otherwise caused by the conventional therapy are reduced.
Yes, because previously we used to give majority of the patients, especially in a stage 4 lung cancer, we used to give chemotherapy and the median survival used to be around 6 to 9 months. But with the advent of precision medicine, by doing a test called as next generation sequencing, if you are able to identify the target, like for example, if the patient is supposed to have a ALK gene positivity, by giving a medication with the oral tablet, his survival can improve from 6 months to 5 years without major side effects. Thus, precision oncology is the new norm in the field of medical oncology.
So do you think precision medicine is readily accessible? And what does the future hold for this field in terms of its broader application, doctor?
In the last 1-2 years, it has been readily available in majority of the labs, but not in the tier 2 and tier 3 cities, but in the cities like Hyderabad and all, it is quite commonly available. And the scope for genetic testing and precision medicine is increasing day by day with the advent of newer and newer molecules which are being developed. So I think in the next 5 to 10 years, precision medicine would be almost replacing the conventional chemotherapy.
So I'm sure that cancer care is a teamwork. So apart from chemotherapy, what are the other supportive departments which you think are needed for the best outcomes for the patients, doctor?
Majority of the times, oncology doesn't mean only a chemotherapy, radiation and surgery. It is the important role of the allied specialties also play an important role. For example, if a patient has undergone a breast cancer surgery, the role of physiotherapy plays an important role in preventing the complications. Like oncophysiotherapy, oncorehabilitation is important. With more and more younger people getting diagnosed with cancer, the role of genetics and genetic counseling and genetic testing has also become an important thing. Third important thing is the role of diet. Like especially majority of these cancer patients are poorly nourished, and if the patient has malnourishment, then the side effects would increase. So it's an important to involve dietitian in the role of during the journey of a cancer patient's treatment. And most important, the psychology. The majority of the times these patients are more or less depressed. So we need to counsel the patients and involve the pain and palliative team and also psychologists in the treatment of the cancer patients. So treating a cancer patient should be in a holistic view, not just chemotherapy, surgery and radiation. We should take the help of physiotherapy, rehabilitation, dietitian, genetics and pain and palliative care. Then you would be able to give the better care to the cancer patients.
So before we wrap this episode, what message you would like to share with our audience out there as far as cancer care is concerned, especially in our country?
2 to 3 important things which I would like to tell the audience is, first important thing is to know about the risk factors and how to prevent the cancer. Like for example, adopting a healthy lifestyle, avoiding smoking and alcohol, maintaining the healthy diet and maintaining the healthy weight and avoiding the sedentary lifestyle. Second most important thing is screening. Timely screening is most important and early diagnosis saves lives. Third, do not fear for the treatment. Now we have got a lot of newer advances with very less side effects. So healthy lifestyle, adequate screening, appropriate diagnosis and usage of newer modalities of treatment would be the message from my side.
So thank you, Dr. Rajesh. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Remember, personalized cancer treatment is the way forward, which is more effective with fewer side effects. Don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.